Whether it's ICU nursing you're about to go for, or accident and emergency nursing, anesthetic nursing, or probably perioperative nursing, before you go for that specialty, there are a couple of things you need to consider. Yeah, slow down, slow down. I know you're about to go for that specialty because their specialty has a very high paycheck. But come on, there are other things you also need to consider before choosing that specialty.
I'm trying to test my microphone. Microphone testing? 2, 3. Faith, you got this, okay? Stop.
Hi guys, welcome to my YouTube channel. I'm Nurs.Fay and on this channel we discuss about health and wellness, illness and disease, life as a registered nurse, or probably as a nursing student. So on today's video, we'll be discussing 6 nursing specialties, what they are, what is required of you before going ahead to study them. That's after your basic general nursing, and lastly, where you can go ahead and study these specialties. Then we'll also be listing other nursing specialties, but we won't be going in details with others, right? Like with other of them, but we'll be going in details with these 6 nursing specialties. Like I said before, there are a couple of things you need to consider before going for that specialty. One of them is what? Your interest. Second is your personality. Third is your stress management. And last but not the least, high paycheck. Come on guys, we are all here for the money, right? But in as much we are here for the money, hold on, like there are other things you need to consider. So don't just go for that specialty because yes, it's a high pay, anesthetic nursing, they pay, maybe we'll go for it. So pause, just tell us, okay, before you go for that specialty, just think about this couple of things I'm about to discuss. So first on the list, let's talk about personality. Now, what is personality? Personality is just simply a group of characteristics that make a particular person unique. It makes you unique as a person. So, what is your personality? This is a question I'm expecting you to throw to yourself. What is my personality? Am I an introvert? Am I an extrovert? Can I handle? Am I too emotional? Am I cognitive? Am I very, very strict in my personality? What are you? What can you stand? Are you the type of person that you're very emotional, you can't stand blood? Probably. So let's say, for example, you're very fragile, like you don't like to see blood, you don't like to see all this stuff, and then you go and pick perioperative nursing, and you go ahead and study them. Like, how are you going to survive in that theater when you're being, well, probably when you're in that theater and a particular patient's leg is being amputated, and then you see blood gushing out, like, how are you going to survive here? Like, and this is what you're doing for the rest of your life. I forgot to mention this to you. Picking a specialty is like you choosing a particular branch of nursing that you are going to study, like that you're going to do, like you're specializing in you're specializing in that particular branch of nursing for the rest of your career life. So this is one of those big things, like those big decisions in life that you need to be very cautious while taking step, like taking a decision on it. So that's all about personality. So you need to ask yourself, what is my personality? So second on the list, we are going to talk about interest. What interests you? What do I find not boring, not something that is fascinating to you, something that draws your attention? That's just simply your interest. Can you actually, find interest in this? Do I find interest in this particular specialty? Is this thing going to be something that when I'm doing, I'll be okay with it? I'll be happy doing it. Like for example, let's say for example, you are a type of person that you can't handle kids. You don't like kids, probably. You just don't know how to manage or handle children. That's just your like that's your, and then you can't pick a specialty like pediatric nursing. Yeah, babe. You and those children, you go both of you now, eh? You see shege in that pediatric, like those children are going to show you shege because if you are picking a specialty like pediatric nursing, you should be a person that have patience, like patience, because kids can actually be kids. They can do and undo. So you need to be somebody that is patient. And is this something that interests you? When staying with kids, are you happy? Is this something you're okay with? You don't just those, this is something that interests you. Like, how does it make you feel? You staying in that particular, that particular ward, or should I say unit? Can you handle the stress and everything that comes along it? So that is all about interest. Pick a specialty that you find interest in. If you're a type of person that you find interest in something like surgery, theater, and other stuff, just go for that perioperative nursing. If you're a type of person that you find interest in children, you like playing with them, go for that pediatric nursing. Or probably if you're the type of person that you like fast tracking, you like code, you like all these sounds called code blue, code black, code red, just go for that accident and emergency nursing. Come on, just go for it because you have interest in it. In as much as then you should be considering the pay. But come on, go for what can interest you, something that draws your attention, like you can actually handle it when when the trauma, or should I say when the psychological stress comes in, you can actually take it in and see something that you're enduring while doing the work. Third on the list, we are going to be discussing about stress. Stress is just an external stimuli that comes in, and then how can you actually manage? When we talk about stress, a lot of things comes in your work life. Nursing itself is very stressful. Like the work, the nature of the work is very stressful. But in as much as it's very stressful, can you handle that particular stress? Are you the kind of person that can handle much stress, or you can handle what is your stress threshold? When I mean stress threshold is, I mean like the limit you can stand. When you hear people say, when you hear about stories that a nurse fell down or she broke down, this and that, these are just person has exceeded his or her stress threshold. So you need to know if you can actually handle the stress in a particular specialty. Is it something you can do? If it's not something you can do, just don't do what. Just don't go for it because we're talking about a very particular, like a very long period of time. Let's say, for example, you are the type of person that you like to do your things slow and steady. Slow and steady. You like doing your things slow and steady. You don't like, you can't, let's say, for example, you were placed in accident and emergency unit. Accident and emergency unit is always rush hour, code blue, all that stuff. You need to be smart, accurate, and fast. So these three things comes hand in hand. So in that particular type of setting, accident and emergency unit, the stress there is going to be much. Imagine when you are now, like, you've worked for like 6 days straight night shift, and then probably the seventh day they bring in, probably there's a mass casualty coming in. Can you actually handle it? Is this something you can stand up to? So that's why you need to consider your stress management, like your stress threshold. If it's something you can handle, if it's something you cannot handle. If you know that you can, your stress threshold is very low, my dear, just carry your busybody, come out of that accident and emergency nurse you're about to go for, or probably any other specialty that you know that there's much work in it. Just carry your busybody jejely, come out of there, and then go for that particular specialty. Like, for example, anesthetic nursing, that it's just all about administering anesthesia. You just have to be careful, slow and steady. That's what you need. Somebody that is, probably you are the type of person that is slow and steady. Just go for that. What anesthetic nursing, just go there. Don't go for that accident and emergency nursing, because, my dear, at the long run you might actually break down. I'm not praying for that too, but I'm just saying that this is what you need to consider before choosing that specialty. So, lastly, the next thing I'm going to be talking about is what? High paycheck. This is where the main game is now. We all know that nursing is actually paying well outside the country, or probably it's not paying well in here in Nigeria. I don't go lie for you. I don't go lie for you. Like, nursing pay here is actually very poor. And that is why most of us are going for, probably we are going for our BSc. That is if you're just having your RN, or if you have a BSc, you can just go ahead and do your specialty. That's where you can actually have a pay that what it's here in Nigeria. Let's just be frank with each other. And then, all those stress that you pass through in nursing school, and you'll be feeling like when you come out, they'll be paying you one kind, they'll pay you like one. Hey, babe, there's no money there. There's no money in the nursing health sector. Like, it's dead. So, in as much as that, if you're going for a specialty, and then you know that you can handle all these couple of things I've mentioned, then there are actually specialties that pay very well. I'm not gonna lie for you. There are specialties that pay very, very, very well. First on the list is anesthetic nursing. Anesthetic nursing pays very well. Accident and emergency nursing pays very well. In fact, all the specialty pays, but they are top ranking: anesthetic nursing, psychiatric nursing, ICU nursing, and accident and emergency nursing. All these specialties pays well. So if you're thinking of, for the money and high paycheck, these specialties actually pay well. So this is where you consider your money at hand. So there's a saying that says you cannot make it actually in your comfort zone. So you need to get out of that your comfort zone. Go to somewhere that is your uncomfortable for you to make it in life. So if you're that kind of person, human being, if you are that kind of person that you have that type of personality, then babe, go for that anesthetic nursing. Come on, go for that accident and emergency nursing, that psychiatric nursing. Go for it, okay? If you know you can actually do what is inside of it, okay? So now, after talking about these four things, that you need to consider before going for nursing specialty. Now we are going to discuss 6 nursing specialty details, what they are, what is required of you before going for these specialties, and where you can actually study the specialty. First on our list is what? Anesthetic nurse. So this is a particular specialty that is being consigned with what? Administering anesthesia. So people that are going for this specialty, what they do is that they administer anesthesia to patients and then monitor their vital signs, before surgery and others, or as surgery goes on. So this is what this specialty is all about. Now, for you to study this specialty, there are universities you can go ahead and offer this particular specialty. First on our list is what? University of Lagos, and second is University of Nigeria and Soka. Third on our list would be University of Ibadan. Now, before you go for this particular specialty, take note, you need 2 years experience, like 2 years post graduation working experience. That's after your basic general nursing, before you can actually go for this particular specialty. Second on our list is ICU nursing. ICU nursing simply stands for Intensive Care Unit. Now, this is a specialty that's been concerned with providing care for critically ill patients. That's patients between what? Life and death situation. So imagine you going to work every day taking care of patients between life and death situation. That's critically ill patients. So that's what you're doing. So this particular specialty, if you want to go for it, just know that you need to be strong. Like you need to be fit. You need to be fit to take up anything that comes up in the ICU. So where you can offer this particular specialty, we have number 1 on the list, which is Lagos University Teaching Hospital, that is University of Lagos. Second on the list is what? Alex Ekweme Federal University Teaching Hospital, that is in Ebonyi State. So before you can actually go for this particular specialty, which is ICU, you have to have about like 1 to 2 years nursing experience, that is post-graduation working experience. But in certain scenarios, like certain situations, some universities, or should I say some of these schools that offer this program, they can maneuver some things. They can maneuver it like you will not really have to have up to 1 year working experience, that is post-graduation working experience. You can actually go for this specialty. What you got to do is just know the particular specialty you want, go to their school, like these schools I've mentioned, and make inquiries. Like there can be a way out. You don't really have to have like up to 1 year or 2 year working experience. So that's just what I see. So third on the list is what? Accident and emergency nursing. Now, what is accident and emergency nursing? This is a particular specialty that is being concerned with providing immediate care towards casualties and patients that are under critical state and probably suffered from injury, probably from accident and all that stuff. So, one thing about this specialty is that if you want to go for this specialty, you need to be smart, accurate, and very, very fast, because in this particular specialty, you don't know what to expect. Like, you don't know who is coming to the emergency department what day. It's unpredictable. So, babe, boo, you need to be very, very smart with this particular specialty. You need to be smart to go for this particular specialty. So places you can actually go for this specialty, one on my list is University of, that is Port Harcourt University Teaching Hospital. Second on my list is Ezza Post Basic Accident and Emergency School, and this is actually located in Imo State. So for you to go for this particular specialty, what is being required of you? Same thing, 1 or 2 years post basic working experience. So this is what you need before going for this particular specialty, accident and emergency. But I bet you, like, this particular specialty, it's really, really interesting. That's if you're the type that you like code blue, code black, this and that, just go for this specialty. Like, you enjoy it, like, and guess what? Its pay is very, very high. Like, I'm not talking about Nigeria, like outside the states. It has very high pay. Like, when you're talking about ego, you go for this particular specialty. So, fourth on the list is what? Pediatric nursing. This is a particular specialty that's concerned with providing care for what? Children between what? Infancy to what? Adolescence. So now, if you're a kind of person that you like playing with children, you like kids, you just find them fun and you have your interest in them, then you should be going for this particular specialty. Places you can offer this specialty. First on my list is what? Oshun, that is Oshun University Teaching Hospital. That is in Oshobo, Osun State. Then second on my list is what? University of Lagos Teaching Hospital, that is LUTH, of Lagos State University Teaching Hospital. So Lagos State University Teaching Hospital actually offers a lot of specialties. So that's why you'll be hearing that particular school from my mouth a couple of times now. So now for you to go for this particular specialty, which is pediatric nursing, you don't really need like 1 year or 2 year working experience. Like you just have a couple of experience that after nursing school you can actually go for this particular specialty ASAP. Like all you just need is your license. Once your license is out, you can actually go for this pediatric nursing. There's no much post-graduation working experience that is being required. So fourth on our list now, we'll be talking about orthopedic nurse. Now this is a particular specialty that is concerned with what? Providing care, prevention and treatment for musculoskeletal disorders. Anything that has to do with bone, bone, then this is what the specialty is all about. So if you're a strong-hearted individual, like your personality, then you can actually go for this specialty. There are a lot of places you can go for this particular specialty, but first on my list is National Orthopedic Hospital Ibobi, that is in Lagos, and we also have National Orthopedic Hospital that is in Enugu State. So for you to go for this particular specialty, you need about 1 year post-graduation working experience. Last on my list is psychiatric nursing, but come on guys, see as my eye dey open now. This particular specialty are for people that their eyes are like this, if you're in for the money, like anesthetic nursing. Like when we come to the ranking, after anesthetic nursing, then you see psychiatric nursing. So psychiatric nursing is a particular branch of specialty that this specialty is concerned with providing care for individuals with mental health disorder, that is mental illness. So places you can actually go for this particular specialty are: one, we have Federal Neuropsychiatric Hospital Enugu State, and then we also have School of Psychiatric Nursing that is in Uselu, that's Benin State. Then we also have School of Psychiatric Nursing that is in Yaba, that is Lagos State. So these are 3 places you can actually go for this specialty. And then for you to go for this particular specialty, you need about 1 to 2 years working experience, like this particular specialty. So there are other specialties, but most of these specialties, like you need your license, you need your post-graduation working experience before you can actually go for them. So then other specialties you can actually go for is we have Oncology Nurse. This is a particular specialty that is concerned with providing care for what? Cancer patients. We have Neonatal Nursing, and this is a particular specialty that is concerned with providing care for neonates, that's between 1 to 28 days, that's newborn. Then we also have Dialysis Nurses. Now Dialysis Nursing and Nephrology Nursing is the same thing, like they are the same specialty, and all they are concerned with what? They provide care for patients with what? Kidney failure or kidney damage, any kidney disorder, that is renal failure or renal disorders. They provide care for patients with that particular disorder. So that's what nephrology nursing or what dialysis nursing is all about. Then we also have midwifery. To be frank, midwifery is a specialty, but it's kind of outsourced in this particular generation. Like everybody is a midwife and people don't know go for that particular specialty, but you can still go for it. Like if you have interest in delivery, childbirth, antenatal and other stuff, everything that concerns pregnancy, you can actually still go for that particular specialty. So we've come to the end of this video. I hope you learned it, and please like and subscribe to our YouTube channel. I'll be dropping our next video soon. Bye.